Good morning or good afternoon and happy National Public Health Week. We are so glad you're here today to join us in a conversation about community-led movements that are creating a stronger, safer, healthier, and more inclusive world. The National Public Health Week Forum is the kickoff to National Public Health Week. And this is an opportunity to celebrate public health and all of the work you do. So let me start with a thank you to all of you in the audience who are frontline public health workers, who are the people who really keep communities healthy every single day. And we would not be where we are in this pandemic without you. And we are seeing light at the end of the tunnel. So thank you for all that you have done. There are so many activities this week celebrating public health, and I hope you have the time to participate. And if not able to participate live, there'll be lots of opportunities to come in afterwards. So check out National Public Health Week, our website, nphw.org, to find all of those events. And I hope to see you at even more of those. Let me start with just a general thank you to our panel. But I want to now kick off the forum with one more piece of news, or one more information, and that is I want to thank the Aetna Foundation for all that they've done to support this forum and National Public Health Week. Our keynote speaker, who I'm very excited to introduce, is Jackie Byers. And Jackie has over 25 years of experience working in low-income communities of color as an organizer and trainer on a broad array of issues, including police abolition, tenant organizing, youth organizing, regional equity, and more. She's the founding director of the Black Organizing Project in Oakland and has led the groundbreaking police-free schools work for over 10 years in Oakland. The Black Organizing Project is a member-led grassroots organizing organization who organizes Black leadership to heal and organize the most impacted communities in the Bay Area in order to achieve long-term systems change. Prior to directing BOP, Jackie served as the associate director for the Center for Third World Organizing, where she had the opportunity to support community organizing work by providing training and developing some of the most talented young organizers in the country. While Jackie has been in the Bay Area for over 15 years, we've learned that she's a native of Minnesota, where she worked as the lead organizer on the ground for neighborhood-based organizations in Minneapolis on affordable housing. Prior to moving to Oakland, she was the training director for the Organizing Apprenticeship Project in Minneapolis. Before leaving Minnesota, she served as an active board member with Headwaters Fund for Justice. Jackie is a firm believer in the importance of community, spirit, and culture as essential to the transformation of individuals as well as institutions. Thank you, Jackie, for being here, and I look forward to hearing what you have to say.
Thank you, Susan, and thank you so much. It's an honor to be asked to be here today on behalf of the Black Organizing Project, to be able to speak. My mom is actually, I think, a member of the association, so she was excited because she is somebody who's worked in public health for a number of years, and we've often talked about the importance of making those connections of community organizing and public health. So there's so much to share around the work that we've done in Oakland and the importance of police-free schools. And so what I could be here forever, but in the time that we have, I want to at least touch on a few things that I think are important. One is obviously what we actually won in Oakland and the implications around that and why we did it. Why was this an important issue to fight for police-free schools and to address the issue of policing in our communities? And then a little bit about sort of how we won or how we worked on this issue and where we're at now and what's sort of next on the horizon. And hopefully how it might intersect when we think about health and we think about health holistically, which is something I really appreciate about being asked to be here. I think that we're at a time where we more than ever understand that the issues that impact our communities are intersect, and that health is both physiological, psychological, physical, and that we all are interconnected. And so I just want to share some slides. Hopefully this works to kind of walk us through a little bit of a presentation. So I just want to start out with, this is this quote from Martin Luther King, and it has a lot of meaning to us and to our campaign. And I'll probably close with this as well. Because when we set out to do the work we did in Oakland to address the issue of policing in schools, we started out in 2011, and it actually was very controversial. A lot of folks thought that, you know, it was an unrealistic pursuit to address the issue of policing and to address the issue of policing in schools beyond just asking for training or reforms, but to actually contend with the idea that police don't actually mean safety, especially in Black and Brown communities, and that we actually were calling for the removal of police and actually police-free schools in Oakland. A lot of folks thought that that was something that we couldn't win. And when we started that campaign, we really had to step out on a lot of faith that we had to take on something because it was important. It was something that the community was calling for, and that sometimes you have to be in the ones that take on something, even if it's sort of a lonely road at first. And also to just hold on to, these are just some faces of people that were murdered most recently at the hands of police. And we just want to hold them as we think about what we do, and that, you know, we do it in honor of them. And that this is not just about what happens in one city, but it's what happens across the country. It's about what happens in communities everywhere. And that the work that we are doing in Oakland, we hope has positive implications for other school districts and other cities and municipalities across this country. And in this picture of people, and if you recognize their names or their faces, if you could put their names in your chat or just say them out loud. But you know, one of the people in this picture is Raheem Brown, and Raheem Brown was killed at the hands of Oakland school police in 2011. And this is what sort of inspired our campaign. It was actually a low profile case. Oscar Grant, who you see in this picture, was murdered at the hands of Oakland BART police. And it was a pretty high profile murder. They caught it on video, and it led to a lot of protest and actions and in the city and across the country and even internationally. Oakland is a place that is known for a long history of activism and progressive politics, but it's also a place that holds some of the same disparities that other places that aren't seen as progressive across the country have in health and employment, economic disparities, racial disparities, and disparities in education and in discipline, police referrals and police arrests. And so we really were curious when we found out that Raheem Brown was killed, is how and why is there a school police force? And so we set out to do more research to look into the issue. And so I just want to play, hopefully this works. You know, part of looking at the issue of policing, starting an organizing campaign around it, and is looking into data to understand, wow, you know, Oakland has its own police force. It had its own chief of police. This is unique because a lot of school districts will contract with resource officers, or they have policing programs, but Oakland had, similar to Los Angeles, an actual police department inside the schools. And so that really threw us for a loop, because we're also looking at schools in Oakland that are largely disinvested in. You don't have librarians and nurses and school counselors. And so to think that we actually have our own police force in our schools was, you know, surprising. And so we looked at, data of arrest, we looked at data of referrals to police, suspensions, expulsions, all of it. But what the data doesn't always tell you is sort of the feeling or the trauma behind police interactions. And so, and which I would say is part of the contention we have in this country around reimagining safety, because for some folks, the experience of policing for them gives them comfort. Having a police around makes them feel safe. And that's largely around distinctions around race and class. So if you're a young white person, maybe in the suburbs, you haven't had negative interactions with law enforcement, you may feel like having police makes you feel safe. But for Black and Brown communities, there's a direct traumatic impact of having police presence. In fact, data tells us that even if it doesn't lead to an arrest, a young person or a student who has an interaction with police, a questioning or interrogation, even if it doesn't lead to arrest, actually has a higher incidence of being suspended or expelled in the future. There's something that it does to a person. And so we have used this as a way to talk about this in our community. And I'm just going to play a little bit. Oops, I thought that was going to play. Let's see if that works. Yeah. So this kind of demonstrates what over-policing is like for a young Black person in Oakland. So if this is a young person, say a middle schooler, who lives in public housing in Oakland, for example, they may wake up getting ready to go to school and have, as soon as they get out of their apartment, an interaction with housing police. And when you think about what has that meant, this is Tamir Rice, a young person that was murdered at the hands of police, probably not much difference in age, maybe a little younger than a middle schooler. And so just to know that when you see an armed police officer, when you wake up in the morning, it has an impact, a stress impact, a psychological impact. Then on the way to transportation to go to school, you might run into city police. And you may recognize Mike Brown, who was murdered at the hands of city police in Ferguson, Missouri. Then you might take public transportation to school. And so you might get on the train and you will run into BART police on the train on your way to school. And in Oakland, we remember Oscar Grant, who was murdered at the hands of BART police, unarmed, on New Year's, on the platform for many people to witness. And then when you get to Oakland schools, you will run into school police. And again, we remember Raheem Brown, who was 20 years old, unarmed, in the passenger seat of a car, and was murdered by 2 Oakland school police officers. So again, it's important for us to remember that policing has a traumatic impact in Black and Brown communities, as well as physical health impacts. And when many of us are watching the trial of the officer who murdered George Floyd in Minneapolis, which was not far from where I used to live before moving to Oakland, and hearing the young people describe what it was like to witness that, it has an impact. It has a collective grief. And so to be a young Black child in Oakland and know that you could be policed on the way to school, and once you get to school, by 4 policing agencies, and then on the way back, you could reverse that. And so a person could have like 8 encounters with police just going to and from school each day. And yet in that same student would have almost a 1 in 2,000 chance, according to our data in 2013, of running into a school counselor or restorative justice counselor. And so we always saw like an incredible investment in policing in our schools that was disproportionate to the investments and things that we thought and where students thought were positive supports for students, positive adults, the things that you think make up a school environment. And all the listening sessions that we had with hundreds and hundreds of students and parents and community members, if you ask them, what do you want to see in your school? What do you want to see more of? What would make your school a great school? No one in all of those times ever said more police. And so we decided to, again, pursue an organizing strategy, which involved a collective of community organizing, community people, parents, students, and community members to address this issue of over-policing of Black youth, and specifically of policing in our school system. And that really to us was important because it really contended with this institution of education that for many of us, we see as this sort of opportunity and great equalizer and safe space. And so looking at how our education system is complicit and really a school to prison pipeline was important for us to address in this larger context of policing in our communities, how it intersects with race, how it intersects with education. So we started a campaign in 2011, and we did a lot of research. We did, like I said, community research, which was listening sessions, door knockings, one-on-ones, as well as actual like looking at school district data from the county, data from the city, and also just case studies and understanding what other cities were doing nationally and all of that. And we realized that we were probably going to be the first to call for the elimination of an entire police department. We started out trying to do some restrictions. We laid out a 5-phase campaign, and we had determined in 2011 that by 2020, excuse the spelling error, 2020, we would eliminate the Oakland Unified School Police Department. But we decided to do a 10-year campaign that would do things in phases. So in the first phase was a lot of research and building our community base, understanding that this was, if you do community organizing, you need to do it with the people that are most impacted, as well as then working on some restrictions to try to restrict the role of police. We did MOUs, we did policies. And while those things were important, we also saw that there was a lot of limitations to that. We also did some reductions. We significantly reduced the police force over the last 10 years by at least 3/4. And then finally, phase 4 was the elimination of the school police department, and then moving towards a transformation or implementation process, which is where we are now. So on June 24th, in 2020, we won the George Floyd resolution to eliminate the Oakland Unified School Police Department. It was, again, an historic win, the first of its kind in this country. And we also won a community process that would partner us with the district to develop the implementation. This was a very hard fight. In March of 2020, we tried to at least, bring this to the school board. We lost by 1 vote. But what we knew in March of 2020, and this was before the pandemic and before everything shut down, is that what we had won in that 10 years was a shift in the city of Oakland. We had a united front of teachers who we had to do work with to understand what was their role in creating safe schools and where had they been maybe complicit in the school to prison pipeline. We had librarians, school nurses, we had parents, we had students, we had community members, and we had a real sort of multiracial movement that had gotten behind our demands and had said this issue is critically important to moving forward in Oakland. And so it was a historic win. It was, the way we won was amazing, but in March we lost, right? So even though we felt like we had lost with the school board, we knew that we had won something as a community. And so I remember being at the school board meeting, and it was full, because it was the last time we were in person, full of community members saying, we have to take this on. And even though we lost the vote, we looked at the school board and we said, we will be back. And, and of course, then a lot changed in our communities, in our country, in our world. We ended up with a pandemic. We had to shift our organizing strategy from being in person to being virtual. And then we had these tremendous, horrible murders, by police across the country. We were all sort of collectively grieving what was happening around us. And, the murder of George Floyd also sort of led to sort of a moment in this country where people were beginning to see that we could no longer settle for the conditions that we were in. And so we were able to organize some of that sort of momentum that was happening, of course, in Oakland and across the country, and pivot people towards really working on finally, getting us to this victory that we had worked for 10 years to get to. And so we did a 10-day of action campaign to push the school board to finally make the courageous decision. Of course, in cities like Minneapolis, they had also ended their contracts with the City of Minneapolis Police Department. Following the death of George Floyd, the schools, the University of Minnesota, as well as Minneapolis Public Schools, ended their contract. And however, we understood that eliminating a department was going to be important, even to cities like Minneapolis, who may have thought that having their own department would have been an alternative to having a contract. And we really want to address the issue of policing in general in all its forms. So this win was really important. But we knew that it didn't end there. So we then entered into what we're calling 3 phases of implementation. And so the first phase was to finally, the resolution called for the department to be eliminated by the end of 2020, by December 2020. So we had to work on literally purging policies that referred to the police, setting up structures to get us to a place of reasonable compliance for that to happen. And then we're now entering into what we call phase 2 of implementation, which is about really bringing together a broad group of stakeholders to move some serious cultural shifts and all of that. We're in the process of reopening in the schools, and there's just a lot of details that has to take place, like what happens to the security guards that were once under the police department? How do we build culture and climate ambassadors? We did a lot of research around the service calls that were being made to police, because what we don't want to happen is that we eliminated the school police department and now people are calling city police. Again, we're pushing for police-free schools. So in order to do that, we have to have viable alternatives. So we had to look at what were the top service calls. And so, for example, we know that one of the top service calls is for mental health crisis, for 5150s. So we had to put together a structure that would address what are alternatives to dealing with mental health crisis. These are some of our bottom lines for the implementation. Again, was making sure that there's clear protocols if police are called onto campus, re-looking at all of the calls for service that have been made to police and what are actual legitimate calls for service, and really addressing those issues versus shifting the culture where people were calling police for things that they shouldn't have been calling police for because they were just sort of leaning on police because they had their department. So we have to address that as well. Redesigning job descriptions, and really looking at how we reinvest in new alternatives. This is an example because we're in implementation of how we're looking at even, each call for service. So this is like an example of a mental health emergency. So whereas people were, the first thing folks did was you call 911 and you call OPD to respond to a young person who's having a mental health crisis. Instead, we're looking at other structures within the county, other services that are there, as well as creating kind of a response team that's made up of sort of a holistic response team that also includes community organizations, social workers, psychologists, teachers, trusted adults, folks that can stand in as sort of accompanying folks during, when they're trying to figure out what to do, as well as building relationships before there's a crisis. And so, we're in a moment right now where, this is something that we're implementing. We don't see this as something that's going to happen and overnight. We didn't start this just to eliminate a police department. We had started this to transform the way we look at safety in general. We wanted to challenge the sort of criminalizing that happens, especially of Black students. We are pushing for something called Black Sanctuary, which is really encompassing sanctuary for all students and all families. And really looking at how this intersects with the bigger picture, the bigger issues that are happening in our country. And so just to kind of close that out, again, I just want to close out by remembering that in this moment, there is a trial that is happening, and we are hearing folks talk about the blood alcohol level that was in George Floyd's system. We are hearing people talk about, whether or not he was deserving to die. And this is something that we have to contend with in the United States, is our relationship to policing, how it's connected to our relationship to Black people, to anti-Blackness in this country. And we also have to contend with the fact that there is a collective impact to our communities when we see someone who looks like our uncle, our father, our sister, our brother, our son, murdered at the hands of police. And so we have to address this issue, not just as a policy issue, not just as a policing issue, but it truly is a public health issue. And it's going to take all of us. Justice is not going to be won in a courtroom. Justice, in order to really, really win justice, we need to take on the spirit that we had this summer, where people who may not have been looking at the issue of policing, we're stepping in and saying, we have to do something different. We can no longer settle for these sort of casualties that happen in Black communities and turn our heads. And so I'm hoping that as we move forward, that, folks in healthcare, folks that are social workers, psychologists, and healers, this is not just about clinical kind of health. It's also about community health and community healers and bringing in culture, that we will all see this as something that we need to address. And we will all look at how maybe we've been complicit in criminalizing Black and Brown families and communities, and what we are willing to do to be part of changing that dynamic. And I'm just gonna, with that, stop sharing.
Thank you, Jackie, and congratulations. 10 years is a long time to work towards something, and the fact that you accomplished such an important and precedent-setting rule and change is really so impressive. So my hat's off to you. That was it was fascinating to hear about. We have a couple questions from the audience, so I'm going to just throw those at you. The first one is, do you think the higher crime rates in open areas correlate to increased interaction with police? And the second part of that is also, how would you address the rise in violent crimes and thefts in areas that have tried policing alternatives?
So I think that, one of the things that comes up for people, a counter is, and we're actually getting ready for this to happen on the schools level, is that as soon as there's any sort of tragedy or spike in crime or something that happens, people will attribute it to the defunding or the elimination of police. In fact, we've had very explicit conversations with our school district to say, okay, superintendent, are you ready that the first fight that happens on campus, even if these things were happening anyway, people will say it's because there's not a police force. The truth is that police do not actually prevent anything from happening. They react. I don't even think they always respond. They react to something that is already happening. So you have to sort of go and look at what is the root causes of what's happening in our communities. And so just taking a microcosm of schools can be helpful, because sometimes when people imagine cities, it sounds too big. So when you look at schools, just think, we're asking students, and we did some data research and saw that spikes in suicides and mental health crises actually happen at certain times of the year, including spring. So we're asking people who have been locked down for an entire year, young people and families, and who have been in crisis, who have been socially isolated and who have been doing distance learning, and may have even lost family members to COVID, to come into a school setting with teachers who are also equally traumatized. And we're asking them to try this experimental sort of in-person hybrid. And we should assume that there's going to be feelings and reactions and responses. So what would it look like instead to create sort of a more public health model that wraps around people and holds the fact that people may have different responses to this, and what are we doing to support folks, versus how are we going to get ready to punish the children when they act out? And so again, I think that the key thing to do is to know that whether you have, that police don't actually, and in fact, our school police officer said this, we don't stop things from happening. They don't stop things from happening. But when you say, why is there increases in crimes in our community? We're also look at all the other things that are happening. People are losing jobs. People are going through, like I said, collective grief and struggles. So what are we doing to address those root causes? Because police don't actually stop, again, things from happening.
So it's classic public health, which is actually looking at what's determining versus just looking at the immediate activities. Thank you. So next question for you is part of police-free schools de-escalation training for teachers and other school staff members? This question comes from a nurse who found this kind of training very helpful for her behavior reactions when dealing with patients and coworkers.
Yes, absolutely. We're trying to bring people, also teachers and staff on school sites, into this conversation. So one of the things we pushed for as a community organization is we didn't want this to, and this is what's kind of been different about doing a 10-year kind of struggle, is we're in this for the long haul. So we weren't just about getting rid of something and then leaving and letting the district figure out what to do and then having them impose it on the school staff. We want to make sure that those school staff are part of these conversations. So what we've even heard from teachers is like they need their own support systems. So also making sure that we're doing trainings, we're doing coaching, and we're providing the resources for school staff, not just imposing a policy on them, but really giving them options. So we literally looked through every single policy and said, if this was where you would call 911, who do you call right now? And how do we wrap support around school sites and teachers? How do we listening to folks around what they actually need and making sure that the district is paying attention to those decision makers. So yes, and we also want to just make sure people understand that this is not going to change overnight. You don't shift an entire culture in 3 months or just with a policy win. It means like us struggling through this over the next few years. And there is going to be things that are going to happen, just like there was things that happened when there were police. So we have to have the political will to stick with this, to work towards it, and to struggle with it, and not to just revert back into something that was harmful because it takes some time to develop a new practice. So training is going to be key, but also making sure that it's not just training, it's kind of coaching and support and accompanying people through this transformation.
So I'm going to combine two questions that came in, and hopefully I can do this. The first question I'm just going to read because is thank you for the amount of work that you put into developing positive social change for African Americans within the United States. Awesome. Do you think that racism against Blacks has increased, or is it starting since the murders and protests during the pandemic to improve fairness? And there was a related question about having learned from communities of color that to have leaders who are from communities of color has been a really important piece of moving forward. The question suggested things like President Obama and Black Panther. So to have both real life and cultural references that are widespread. But do you think of increasing the number of police of color would make a difference in this, or is it just an issue of police in how the communities interact?
I'm trying to remember that whole question.
I know.
So I'll
break down the first one. Do you think that racism against Blacks has increased, or is it starting since the murders and protests during the pandemic to improve fairness?
I think that there is a long history of racism in this country, and it takes many different forms and depending on the context. And so at times, we saw this particularly under the last administration, there was more overt sort of exercising of it in places that were much more subtle at times. But what we are trying to address particularly is oftentimes how insidious it is inside our institutions, which I think I would argue in some ways can be a more dangerous form. People kind of stick to, or get locked into sort of people's personal prejudices and how they assert them. But when institutions, when you look at their sort of disparities in the data, and you realize that there are trends that cannot be disputed, and you follow kind of the logic behind it, and you combine that with people's anecdotes and their stories, and you see that it's embedded in institutions that are supposed to be institutions that are working on our behalf. And the impact of that is that individuals, so let's say that you are a Black mother whose children have been suspended, is from, first grade or kindergarten, where we'll see like Black children disproportionately suspended or expelled or referred to the police. Sometimes you think that, did I do something wrong? There's a shame, there's an embarrassment, and you think maybe it's your fault, and that stuff is, sort of emphasized in the media. But then when you bring those parents collectively together and they realize that the same behaviors for white students is punished differently, is deterred versus punished, and they see that these structures and systems are in place, they understand that it's not just about something personally wrong with their child or with them, but that there is a systematic issue that needs to be addressed. And on the issue of policing and diversity, I absolutely do not believe that it's about diversifying the police force. I believe that there is an inherent problem with policing in this country, period. And that it is deeply embedded in our history and in the history of policing in our communities and what police have been used for. And it's also no accident, and this is something we don't talk about as much, but that in places like Los Angeles and Oakland and places that have had a history of progressive radical politics, that is when you saw an infusion of community police or school policing. And sometimes people get confused because we all have this nostalgia. Maybe you watch the Andy Griffin show or whatever, and we have this idea that there's a school police officer playing basketball with kids and it's all good, and it's a different kind of cop than OPD. So what we had to really make sure people understand is these are the same cops. They came from OPD, and they're still police. They're still cops. They're not counselors, they're not teachers, they're not school nurses. So when we get confused about their role, people often start utilizing them, even though they're getting paid 3 times the amount of a teacher, but they begin to utilize them while laying off those other positions. So also just to take that into account, you have that contradiction. You have a city or a school that has laid off all of the staff that research would say actually helps keep the climate and culture healthy, and had maintained a police force. So that tells you something, and it sends a strong message about how folks view their young people. And so I don't know if that answers all the questions, but it's my best.
It does. Thank you. And thank you so much for everything that you've done, for joining us here today, and for kicking off National Public Health Week. I can only imagine how powerful what you've told us is for all of the members, and I know for me personally, so I really do appreciate that. And say hi to your mom.
Thank you so much.
It is now my pleasure to turn it over to our moderator. Dr. Jose Ramon Fernandez Pena is the Director of Health Professions Advising at Northwestern University, where he leads the university efforts to support students interested in pursuing careers in the health sector. He is also the current president of the American Public Health Association. Prior to his time at Northwestern, Jose Ramon was an associate professor and associate chair in the Department of Health Education at San Francisco State University, where his work focused on health, workforce diversity, and cross-cultural communication in health. In 2011, he received the Champion of Health Professions Diversity Award from the California Wellness Foundation and was recognized by the White House as a champion for change for his work on immigrant integration. In 2012, he received the Henry J. Montes President's Award from APHA's Latino Caucus for his work with the Latino community. It is my pleasure to introduce and turn it over to APHA's current president, Dr. Jose Ramon Fernandez Pena.
Thank you, Susan, and good afternoon, everybody. First, I want to say thank you, Jackie, for that amazing presentation. And when we think about the restorative justice practices in schools and the tremendous impact that they have in positive outcomes on youth that is otherwise continue to be oppressed. So thank you very much for that perspective. It's my honor now to introduce a panel as we talk about building and rebuilding. We're talking about building bridges to better health, and these 4 speakers are gonna blow your minds. Let me reassure you of that. First, we have Cody Brayboy, who is a nurse consultant with the North Carolina Department of Health and Human Services Communicable Disease Branch. In this role, he provides guidance and outbreak management, control measure implementation and surveillance in the COVID-19 pandemic response. He's an enrolled member of the Lumbee Tribe of North Carolina. He has a special interest in public health infrastructure, tribal health policy, and indigenous health. Brayboy received his undergraduate degree in American Indian Studies from UNC Chapel Hill and a Bachelor of Science in Nursing from UNC Charlotte. He earned a Master's in Public Health from UNC Greensboro and is currently enrolled in the Doctor of Nursing Practice program at East Carolina University. Thank you, Cody, for being here. Our next speaker is Jerome Foster II, who is an 18-year-old African-American climate justice activist, voting rights advocate, and emerging technology developer. He's the executive director and founder of 1 Million of Us, which is mobilizing a new generation of young people to register and turn out to vote. Throughout 2019, he served as a House congressional intern for the late Honorable Congressman John Lewis. He serves as co-editor-in-chief of the Climate Reporter, an international environmental news organization. Jerome has spoken at the United Nations High Commission on Human Rights, held weekly climate strikes in front of the White House and Harvard University for over 80 weeks as part of Greta Thunberg's Fridays for the Future. 80 weeks. And he's helped to pass the Clean Energy DC Act. He won the World Series of Entrepreneurship for creating a civic-based virtual reality organization called TAU VR. Thank you, Jerome, for joining us today. Our next speaker is Rosemary Ketchum, who is a member of the City Council of Wheeling, West Virginia, representing Ward 3. Ketchum serves as the Chief Operations Officer of the Holistic Youth Wellness Coalition, Edible Mountain. She's also on the board of several organizations, including the West Virginia Center on Budget and Policy. She has been returning guest on MSNBC and has been profiled by several outlets, including The Today Show, Time Magazine, CBS, and CNN for her work in community organizing and politics. Thank you, Rosemary, for being here with us. And last but certainly not least, Lorenzo Lewis, who says, turn your pain into purpose. It's his philosophy that this speaker and social entrepreneur lives by. With a decade of professional experience in behavioral health and the founder of the Confess Project, an initiative that confronts the stigma around mental health for men of color, Lewis helps you confess to your issues to begin to build a better process of living. He's a trained facilitator and speaker, and he's available for speaking engagements at high schools, colleges, and universities, community spaces, and corporate workplaces. Anywhere his message will resonate. Most recently, he was tapped by Google to equip incoming college STEM students from marginalized communities with the mental health tools they need to thrive. Dare yourself to move forward. Lorenzo will be there to guide you. I have a few questions for you, but before we start, I want to take a moment to say that I come to you from Evanston, Illinois, and I want to take a moment to acknowledge and honor the people of the Council of the Three Fires, the Potawatomi, Odawa, and Ojibwe, the original people of this land. And though I do not hold a Native identity myself, I acknowledge the land to express gratitude and appreciation for the first caretakers of it, and to encourage you all to learn about the long history of this land and about the land you live on. Thank you. So let me start with a couple of questions for you all. Let me start with you, Lorenzo. How do you define building community, and how have you done that within your work?
Yes, absolutely. Thank you for the opportunity. You know, I define community. A lot of it is ingrained in the work that I do every day. So at the Confess Project, we are America's first mental health barbershop movement, where we're training Black barbers to be mental health advocates. I define community as just that, right? Being able to have these outstanding conversations, but much needed safe spaces in Black barbershops across America. You know, by doing so, that allows us to really propel young Black men and their families to becoming their best self. A lot of this, again, is about building trust, right? And so I believe a lot of what we do, particularly, is that we, as you have done before starting this, is to acknowledge that historical Black spaces are very sacred. And so as myself, as a Black man going into barbershops, it's a privilege for me as well, because I realize that this is a very sacred tone and space that we utilize. This is also probably one of the few spaces in America where we really can feel ourselves to be seen, heard, and celebrated. So I feel that by building trust and community, a lot of that really lies in just that. And I believe that by practicing trust measures, right, and being able to continue to lean into that, I think you know, it's just going to be intentional. I think that it really builds a very robust of power that we really want to see ripple through our communities. And so I feel that, you know, I think trust is really at the epicenter of this conversation, because I think also we realize that also has not always been practiced in such great light. So I think that I can kind of leave it there. Thank you. That's a really good question.
Thank you, Lorenzo. Rosemary, what would you add to that from your perspective? How do you define building community?
Thank you so much, Jose. I mean, I completely agree with Lorenzo. I think that community ultimately is about shared interest and shared vision. And it's really important while community building that we are simultaneously trust building. You know, so many of our organizations work in this coalition building, and it cannot happen unless there is a foundational building of trust and respect. I find that in the work that I'm able to do here in the city of Wheeling and across the state of West Virginia, trust is really, really important, but it cannot exist without vulnerability. And in so many of the community organizing paths that I've seen, vulnerability is a necessary ingredient in this work. If you cannot be open and sometimes raw with your community, you cannot expect that to be reciprocated. And that requires us to have some really tough conversations with people who we respect, some we may yet respect, but I think ultimately it requires this kind of team mentality that isn't always easy and in many ways is kind of Pollyanna-ish. And sometimes we'll never get to that highest hill. But I do think Lorenzo is absolutely right. Trust is important to center, but I also think vulnerability.
Thank you. Jerome, Cody, would either one of you want to add to this now?
Yeah, absolutely. I think that, oh my.
You're good. You're good.
Cody, would you be able to go first? My audio's coupling.
You're good.
For the communities that I work with, my Indian community, it's important that in order to build trust, that we acknowledge historical traumas and current traumas.
Cody, 1 second. I'm having a hard time hearing you. I don't know if everybody else is having a hard time with Cody's audio. Yes, no? No, I'm sorry. It must be me. Sorry, Cody, for cutting you off.
It's not just you.
It's coming in and out, yeah.
Is my audio working now?
Mm-hmm.
Okay, so I guess I can go. Yeah, I think that one of the biggest things that comes from having a strong community is the ability to have movements. I think that from every strong movement, from the anti-war movement to the Black Lives Matter movement to every movement that's come into fruition has been from a strong community that has built up to that. And I think really from my experience from climate striking in front of the White House and to recently being appointed to the White House Environmental Justice Advisory Council is how do we use community to continue to forge legislation? Because the power of community is how do we use our power in numbers to actually make changes happen? I think that with our marches and with our power in the streets, we can really transform that into legislation. We can transform that into the work that Lorenzo is doing with making sure that we have community that is able to look to each other and build in our own ways. And also with the work that Ms. Ketchum is doing as well. I think that's really powerful is how we have communities and how we look into ourselves and look and have the communities that are safe for us, like barbershops, and how do we look out to other communities and build coalitions. I think that's really powerful when we look at communities is how do we see our own community, build out from there, and make sure that they're set in stone and that they're protected with legislation and that they're safeguarded with how we police them as well. So yeah.
We're gonna go back to Cody now, see if we can hear you a little better. Cody, you want to give it a shot again?
Sorry, is that better?
I think so. Let's go with it.
I'm saying that in order to build trust in the communities that I work with, it's important to acknowledge historical traumas and injustices and to build from that. It's important to listen to community members, those who have positions in the communities and those that are just there to participate, who want their voice heard.
Really important points, all of you. Thank you. So, understanding that the building of community is a critical element, you all really are members of or parts of community-based organizations, creators, launchers. How do you work with public health leaders? And Jerome, let me start with you. How do you work with public health leaders?
Yes, absolutely. I think that with my experience has been from a young activist. I first started out by meeting with the DC State Board of Education and figuring out how do we look out for public health of a lot of young people that don't graduate high school. Like, how do we make sure that we have resources that are available for our peers to be able to look to college and to be able to have that ground level of access. And I think building from there, it has been through the work that I've been exposed to technology, to activism, and thinking like, how do public health leaders not only help to prevent things, but also to work proactively in the future? Like, how do we make sure that we're preparing young people, not just to have the bare bones of safety, but to be able to excel? And that comes from making sure that we have access to technology jobs, to good paying jobs, to make sure that we have access to the most cutting edge technologies. And I think that's how we build safety to make sure that it not only looks at our community and says, hey, why don't we protect ourselves from what's happening today, but look at what's happening in the future. And I think that's really the work that I want to do and continue to do as being a young person, because we're coming of age in the 2020s, and we want to see changes, and we want to see bold changes, because this is a time of where we're reaching a catalyst, whether we're going to look back and not really make the changes that we need to make, like key infrastructure, like environmental changes, like healthcare, like policing. How do we move into this new decade with a new mindset? And that comes from reframing how we think about health.
Wow. Thank you. Thank you. Wow. I want to clone you into 17 million people of you. Lorenzo, what would you add to Jerome's comments?
Yeah, honestly, when I first started my work, it's not being I like to call myself a living expert, right? Someone who's, been incarcerated and experienced depression. Also just being a Black man right from the South. So understanding that in itself was enough to go out and get other men and communities' attention to really not only using storytelling, but I think really being able to build community just on that. I think over our past few years now, we have done a tremendous job of now really trying to integrate public health leaders into our work, whether that's through our board, some of our council. We've trained over 230 barbers in 19 cities across every coast in the United States. And so we're very intentional now about wanting to work with public health institutions, interns, and really understanding that a lot of our young people that are coming through the pipeline of public health will be our next voices, such as myself and those that's even, a part of our younger generation. So, I think one thing that I've been really wanting to ensure that that everybody's commitment is really pure, and I think at a great speed. The community that I think I particularly work with has a lot of distrust, right? A lot of uncertainty. And a lot of this, I think, is because of just so much on the historical grindstones. And so I realized that we have to move beyond that. And so I'm glad that we're at the intersection of moving beyond that by, again, bringing credible public health leaders to the table to really try to move the needle. So I think that has just been through an engagement of outreach that we've been able to do. And again, trying to work with younger public health leaders that are coming through the pipelines that will have such a huge microphone and a voice, and really being able to amplify that as well.
For sure. I think that what you're talking about, this kind of partnership and the trust, and a point you brought up that really resonated with me is the notion of bringing the lived experience into the work that you do. So what you've lived through, what you have experienced, what you have learned, what you have suffered, what is really not only inspirational, but it becomes a very big driver for the work. So thank you for highlighting that. Rosemary, what say you in terms of working with public health leaders?
It's a really important question. I think before the pandemic has really changed the way that we see public health. And I think a lot of folks who aren't familiar with public health, who maybe do not work with the public, the pandemic has really caused us to see virtually everything we do through this lens of public health. And I think, unfortunately, it had to happen that way. But, in my experience as a member of city council, also as a person who works in health, it is fascinating to introduce these public health concepts and methods and models to folks who really didn't know they were there initially. I get to work with public health officials virtually every single day in my capacity as a member of council. And I think what also is happening is that we are redefining what a public health official looks like. I mean, we have the traditional concept of a person who has gone to school in public health and maybe works in the medical field, but we're also looking at frontline workers in all kinds of industries who are de facto public health officials now. And it has, I think, caused a lot of folks to redefine what that looks like and what it means to be a public health official. But I do also think that in so many ways, it has, again, brought the concept of public health to the ground level of our communities in a way that is could be no more real than a pandemic, unfortunately. But I'm very hopeful. And I think a lot of folks who weren't, traditionally tapped into, the field of public health now see it as not only an opportunity, but an obligation to pay attention and to invest their time, money, and effort into improving our public health methods.
Wow, an opportunity and an obligation. I really like that perspective. Thank you for that. Cody, I don't know if you have been able to sign through your phone, but I would love to hear your thoughts on this as well. I think he's having trouble with his audio. But maybe I can turn to you, Jackie, for a second to hear about your work with public health leaders, because it's so intertwined, what you're doing at the community level there.
Yeah, I mean, for us, when we were at the point of really trying to push, for the school board vote, we definitely called on folks within the public health community to talk to the school board members about what the implications were, what the data says about police interactions with students, what, sort of the good practices and positions that some of our public health professionals were recommending. And throughout this whole implementation process, we're going to be calling on, and we're including folks in the design of what do those alternatives look like. And I think that's really critically important. But also just to the point of Lorenzo, also just understanding there's also community practitioners as well, and really bringing in those credible messengers, those cultural healers, and thinking outside the box around those spaces is going to be is still important, has been important thus far, and will be important as we implement new strategies.
I love that perspective from Lorenzo as well. The notion that when we tap on community assets, they mean many things and they look very differently across communities. So tapping on that knowledge, tapping on that trust, tapping on those ambassadors that can convey messages and can inform our thinking as well. So this kind of exchange that goes both ways. Cody, I'm still dying to hear from you. I don't know if we can get your voice now. All right, we're working on Cody's sound. I hope we can bring him back very soon. So since we are thinking that it's important to build trust in this community efforts and to work with public health leaders, I'm curious, from your different perspectives, what partnerships do you most admire? Is there something that says, oh my God, these folks are really, really working great, and I either want to participate in that partnership, or I wish I can have a partnership like that? Can you think of examples like that in your worlds? Whoever wants to go first. You're gonna make me call on you, aren't you? So I'm gonna call on Rosemary here.
Thank you. It's a great question. I think community partnerships and collaborations, I have always been around. And I think in unfortunately the most desperate areas, we see some of the greatest community collaboration and partnership, because oftentimes we assume that those partnerships and collaboration should happen from the top down, but I've never found that to be true. It's always a grassroots movement that actually changes systems and cultures. And I think through this pandemic, again, we have seen some of the greatest partnerships here in the state of West Virginia that I've ever seen. Some of the most intense and successful community collaborations. I'm seeing this in my field, working in youth public health, but I have a background in mental health as well. And I think in many ways we realize and have come to this realization that there is no savior. There's nothing happening from the top down. We really need to bolster and invest in this grassroots movement because ultimately that is what will change these systems. And so I'm seeing that happen across the state of West Virginia and really across the nation. Mm-hmm. And I think it's about time that so many of us have realized where the help is coming from, and that's our backyard. And I think that we are only stronger when we realize that and kind of steel ourselves with that power.
Thank you, Rosemary. Yes, I see Cody is back. Can you hear me, Cody? I believe you may be muted.
Can you hear me now?
Yes, I can hear you loud and clear. Great. So let me get back to you with this question. I don't know if you heard it. We have been talking about working with public health leaders and building trust, and I wanted to hear from your perspective, are there any particular partnerships, community partnerships and activities that you look to as, wow, I want to do that kind of work, or maybe you have established those partnerships and you want to talk about that?
I really admire the partnerships between the tribal nations here in North Carolina and the partnership that we've created with the Department of Health and Human Services. North Carolina has 8 tribal communities, and on the state level, we work really hard to make sure that those tribal leaders have a voice, but not just the tribal leaders, the community members as well. I cover 21 counties in the region that I'm responsible for southeastern North Carolina, and most of those tribes are in my area. So I partner with the local health departments as well as the tribal communities to make sure that their voices are heard and that their needs are met in response to the COVID pandemic.
Wow. Lorenzo, Jerome?
Yeah, absolutely. I think one of the biggest partnerships I've seen over the past year has been between the environmental movement and the COVID-19 crisis. For example, the American Lung Association appointing 2 environmental activists to their board and really showing the intersectionality between how young people have sacrificed our graduation, our ability to be able to be young people, for older generations to be able to have the quality of life they need and to be protected during the COVID-19 pandemic. And now with the climate crisis, we're asking for the same as young people. We're asking for them to really center us because we're the most impacted by the climate crisis. Like they're the most impacted by COVID-19. So we really want to have that intergenerational outlook on like a really powerful partnership to say, we're going to look out for each other, because it can't just be one way. It can't just be older generations looking out for us or us just looking out for older generations. It has to be that intergenerational unity. I think that's one of the biggest partnerships. Also, I would say with the environmental movement and companies now coming out and not just saying they're not just using greenwashing terms, but actually going out and making big strides. Like different companies coming out and now saying they're going to be carbon neutral by 2030 and 2040. That's actually setting a target, and we can hold them accountable to that. That creates, when we go back to community, that now sets a target for the community to say, what did you do this year? And you need to make sure that you're meeting with us to continue to make sure you're meeting those targets. So I think that's really what the partnerships are when, even if it doesn't come from the government, it comes from like local people and people that we look up to in our institutions and say, hey, we're going to work together and we're going to hold you accountable. You're going to hold us accountable. So that's how we like to make strong partnerships, and they can be upheld. So yeah.
Accountability is a very big part of that. Right.
Absolutely. Yeah.
Lorenzo, some closing thoughts on this topic? of model partnerships?
Lifting up what Jerome and others has been able to say that, particularly, us as a barbershop movement that's on the ground, training men to be great listeners, to be empathetic, right, to know how to reduce mental health stigma. We've been able to conquer a partnership with Gillette and Toyota, right, and so, but really just honing in on this partnership we have with Gillette. Really appreciating their intentionality around bringing them forming a barber council now that composed of Black and brown men, across, New York City, Boston, LA, San Francisco, like these key cities that we're expanding into. And so, that really says a lot to us, because we realize that, maybe in the past that, some of the diversity may not have stood up as much as it should have. And so just kind of just enlightening that work, and that's really something that we've been proud of, is to see that there are more Black men that Procter & Gamble and Gillette are lifting up in this moment. I think that's really a huge thing. Also, just the departmental agencies as well. I know that we're doing some supportive work with like the Department of Labor, and some other work with the Human Services Department here in Arkansas. And so, again, as a Black-led organization, we know that historically we're underfunded, we're under-resourced. And so when we've been, again, being able to have these opportunities, I think that it's a very great start to being able to leverage, but beyond that, to be able to get to communities that we really know need the resources and the help that they deserve. And so that's what I'm the most proud of, right? It's not so much as who the partners are, but what can we bring back to help, our fellow brothers and sisters that really need it the most. So
For sure. So there's two things I want to get through, but before we open to questions from the audience. But one thing I notice in all of you is that when you speak, you smile. So I'm guessing here that you enjoy your work. You clearly believe in the work that you do. So I'm going to start with you, Jackie, here. And what part of your day-to-day work keeps you coming back at it? Because I think it's important as public health leaders, especially during this past year where we have seen what we had not seen before. And especially we have been attacked, we have been maligned, we have been really put on the spotlight for all the wrong reasons. But there's something alive inside each and every one of you. I can see it, but I want to hear it. Jackie, let's start with you.
I mean, I think there's two things. One is when we started out this campaign, we were told it was impossible. So there has to be a level of being willing to stand in the impossible. So there's like a spiritual element for me to this work, believing that, we're a part of a continuum of people that have worked hard to get us to this point, and we have a place in that history. And irregardless of what people say you are not capable of doing, believing in the possibility and the power of our collective community. And I actually believe it, and I've actually seen it. So in the middle of a time when we were full of grief and devastation, we experienced one of the most historical wins in this country. And it was led by the same students that may have been pushed out of schools or invisibilized or disregarded, or the same parents that were told that they couldn't change anything, or that they wouldn't be able to do research, or maybe they were pushed out as young people, and community members across generations, and even, Black and brown community members coming together and standing together and saying, we believe that we can win no matter what it looks like, and doing the work and putting in the longevity to do it. And that's what keeps me going, because I actually believe in the power of people. And it's very hard work. It's very humbling. But if it weren't for some people that collectively believed and took chances, greater chances than anything I've ever taken, I wouldn't be here today. So it's my obligation to do what I can in this moment in history, irregardless of the circumstances, because the only other alternative is to accept the conditions. And that's not an alternative I'm willing to accept. So that's what keeps me motivated, is the transformation I see, and have the just humble opportunity to experience that. It's been the greatest thing in my life, and I have to thank my grandmother for opening the doors for me to be able to do this work.
Thank you, Jackie. Thank you. Thank you. Cody?
I think what keeps me motivated and excited about the work that I do is knowing that I'm providing or advocating for the generations that are here now, the tribal people that are here now, but those that will come for future generations. I have a connection to the land here in North Carolina, to the people. My ancestors have lived here for generations, and when I think of the work that I get to do, both in the state level and the community level, it empowers me because I know that I'm protecting where I believe God placed my people, and just being a part of something greater than myself. Because as a public health nurse, I do feel that nursing in itself is a calling, but public health is a calling as well, and I get to marry those two callings and be a voice for not just tribal communities in the state, but for all North Carolinians, for North Carolinians who, regardless of the color of their skin or their religious preference or sexual orientation, I get to be their voice, and I get to protect and promote their health. And that's something that I hold dear, and that I'm just thankful that I have the opportunity to do.
Wow, thank you, Cody. Jerome?
Yeah, I think that for me, a lot of the work that I do really is motivated by it not being my work. It's being my generation's work. It's the work of my generation, like the Generation Z. Like, we grew up in the aftermath of 9/11. We saw, when we were in elementary school, President Obama become the first African-American president. In 2006, that being in elementary school, having the financial crisis really hit us. And in high school, seeing Trump become president, it's been a generation of roller coasters. It's just been ups and downs. And I think that it's now just really amazing to be a part of my generation's work, that we are now like a generation rising to the political and economic and social occasion of that. Like, we are now assuming our power. We're now assuming the mantle of being the newest generation. Like, in 2020, we made up 17% of every single vote cast. And that's a new generation taking the stage. We're here. And I think that's really what's powerful, is seeing that, like, we aren't going away. We're a generation rising to the fact that now, with this new understanding of where we are and how interconnected our world is, we're now championing intersectionality. We're now championing acceptance, and we're now demanding it from our elected officials. And I think that's really powerful in the work that our generation does, is that we aren't really fighting for the things that have been older generations. We're now fighting for the new things. We're now fighting for things that haven't been thought of before. We're now changing the conversation, because 5 years ago, people were still talking about if climate change was a hoax and that Black Lives Matter shouldn't be a slogan. We're now talking about defunding the police. We're now having people of color now being the vice president. We're now seeing consistently that people of color are in offices, and that marginalized communities are no longer being shoved to the side. We're now pressing forward, and we're now demanding change. And I think that's really powerful in the work that we do. And it's not any of our own work. It's just the work of our community that has decided to say, hey, we want this person to be city council member. We want this person to start leading barbershops, that we can have safe spaces in communities. I think it's all of our work that's just here. And I think that's what's amazing about that. It's just the work of social justice. I think that's amazing.
The work of social justice. Rosemary, what do you say? What keeps you going?
It's a great question. And Jose Ramon, I think I misunderstood the last question about community partnerships. So very quickly, in West Virginia, one of the, I think, most inspiring community partnerships is between our racial justice organizations and our LGBTQ organizations. I think they realize that success is mutual there, and that you're only stronger together. So I'm most inspired by that community partnership here in the state. But in regards to the work that I do, I selfishly love every moment of it. And I never thought that I'd be able to get to do it. As a trans person, I never really thought that my potential would be that great, because when I was a kid, I did not see successful trans people represented in the media that I consumed. And so I just assumed that wouldn't be possible for me. And when I won my election in, the summer of 2020, I was overcome and overwhelmed with emotion and gratitude to get the opportunity to serve my community in this capacity. Of course, in the middle of a pandemic with so many other, challenges at play. But I am so grateful to get to do the work of public service and to meet incredible people who are equally as passionate and busy and sometimes chaotic, because this work isn't always linear, as I think we understand. But I'm so honored to get to do this work, and it truthfully is a kind of lifelong experience. You don't just get to retire from public service, as I think so many people assume. It is a kind of, it's in our DNA, I should say.
I think, I forget who said it. It's, I think it was Cody who said it. It's a vocation in a weird way, isn't it? Wow. Lorenzo, you get to close us on this one. What keeps you going, man?
A lot of exciting energy. Really thankful just to hear from everyone. And I think for me, it goes back to, being a 5-6-year-old kid there in a very busy corner avenue in Little Rock in my aunt's beauty salon. And so that was my inspiration, going to her beauty shop every day as a kid, being out, after school, getting off the bus, being able to really witness the transformation and power of a conversation and how they would lead someone to get a better job, to making it through that hard relationship, to getting their kids back on track. That was just amazing. That literally 45 minutes, a 2-hour interval would change somebody's life. And so that never left me, right? So as I went through some of my challenges, I always reverted back to thinking about how they would always be able to be a changing movement. And I think that was a lot of my inspiration. I also think on the other side of this is that, the inspiration again is the men and the people that allow us to come in their bubble, right? Realizing that this is a place of commerce. This is historically one of the first places where African Americans have been able to own and make commerce and create generational wealth. And that's really powerful to bring us in this space and really talk about a health movement amongst that as well. And so I think that's very inspiring, because that really takes a level of leaning in and being intentional. And so I think that inspires me. But beyond that, even, our data says that 90% of our barbers would rather go to see a therapist, whether if it was in the barbershop, than going to a therapy couch. And so that shows us that this is obviously a fantastic way of people getting the help they need. It's not to say that, no one that's at a grandiose level not need to go to a therapist, but also to really reimagine that we have to think about a mental health care system in which, in fact, allows, Black men and Black families to be able to look at this in a very different intervention. And so I'm excited that we're on this journey to continue to learn more. And I think that's what inspires me, that what if we hadn't took that chance to be able to go out to some of these cities and learn this. I'm really more excited for the chance that these communities took on allowing us to come in and be able to make this possible.
Thank you, Lorenzo. Thank you all. I think it's important to take care of ourselves. As I was saying, it's important to be able to step back for a second and think about the work that we do, why we do it, and to allow ourselves to recharge, as I was saying. To the audience, I want to mention now that if you have questions for the panel, please share them in the chat so we can get them to the speakers. So I've tried to avoid those far, but you haven't. Clearly, we've gone through a pretty significant year with COVID-19. And even though we're beginning to see some lights at the end of a very long and very dark tunnel. We're still not out of it by any stretch of the imagination. I want to hear how you yourselves and your organizations or the work that you do has adapted to continue to be effective in this very challenging time. And I ask this because I think it's important that we talk about the pain and we talk about how we have overcome it, and we can all learn from each other as to how we've been able to navigate this very, very difficult time. So I'm not gonna pick, I'm gonna just let you jump in spontaneously.
I guess I can go. I mean, obviously just there's the human element of just all of it, the unknown, the what does this mean and all of that. And I, as a community organization though, like our whole point is to connect physically with people. That part of the thing we're working against is the isolation that people have. And so the whole idea is to bring community together. And so like in the moment that we were in a momentous year that we had already sort of prophesied that we were going to win in 2020, and then all of a sudden we're in a pandemic and we're all shut into our houses. It definitely was like a pivot. So we had to become very virtual. We had to quickly learn how to use online organizing in a way that we really hadn't been equipped before. We did have some funder partners who were willing to give us a little rapid response support. So we also were able to give direct resources to some of our members and community members that we knew were struggling with job loss. And so we had to be very adaptable very quickly. Had to learn how to engage young people online, just trying to make sure we were reaching our folks and connecting with people by any means necessary, so that people weren't just totally isolated, and being willing to sort of meet people where they were at. Also with, ourselves creating mental health days options for people, so that, just being hours and hours of Zoom and the intensity and the pain that we're all feeling collectively, like creating room for that, supporting people at home who have to work at home, and how to make that viable, and also just trying to think about ways that we can offer connection. So we've had to be really creative, even like, sending people care packages. So we've been just trying whatever we could. When we did an action, because, as organizers, sometimes we do direct actions, we had to do car caravans. And just, that's the thing about being in a community and organizing, is we learn how to adapt. But I think also recognizing the toll it all takes on us and making room for that has been important. And it's still an ongoing thing that we're all trying to figure out, especially as students are now going to be returning to schools. And we know the impact of that is going to kind of, have mixed feelings for folks, and how do we support families as they do that.
I'm starting to see some questions coming in from the audience, and I want to get to those as well, but I want to invite any one of you to follow up on how you have adapted to work throughout the pandemic times.
Well, one interesting thing, the pandemic has forced us to innovate, just as Jackie is saying, in so many ways. But what it also has done that, has proved to be, I don't want to say a positive thing, but has been an opportunity. It has revealed, I think, the deep systemic fractures in our community infrastructure, things that we have ignored for many, many years, that our communities have known existed. These aren't new. People were shouting from the rooftops, but so many of our authority, people in authority and decision makers were able to ignore these fractures in healthcare, in transportation, in broadband access, so many in voting access. And I think it now is forcing us to build actionable solutions. Unfortunately, I think, in many of our communities or states that are seeing a supermajority, similar to here in the state of West Virginia, we are unfortunately seeing legislation that is, against, not seeking to solve these systemic fractures, but in many communities, they are beginning that kind of repair that is so necessary. So I think that presents an opportunity for us if we can hold the feet to the fire of our electeds.
Thank you, Rosemary. Lorenzo, Cody, Jerome.
Yeah, I think for me, it was pretty different because of the fact that like the environment movement, I thought invented Zoom until I saw like everyone else was like on it. Like we were on Zooms all the time after school. And I was like, that's just our thing. So the pandemic happened. It wasn't too different of the fact that like we couldn't organize physically and things like that. But for me, before I was an activist, I was a computer programmer and kind of transitioned into activism. So it was kind of like a return to my roots a little bit. But how my organization kind of shifted was being that we were a youth voting rights advocacy organization, we had to really ramp up our GOTV, like going out to door knocking and really renting a bus, and we're going to do a bus tour. We're doing so many different things. We're doing like a TED Talk, and all that had to be canceled. But what we did was we doubled down on like, how do we make this youthful in a new way? And what we did was we turned to virtual reality. And what we hosted a major event called Prom at the Polls in the last like 2-3 months before the election. And we got like a bunch of celebrities to go out and dress up in their favorite prom outfits that they had and just encourage our generation to do the same thing, because we lost our prom. We need to redo it again. So I think it just really reinvented how we use technology, because our generation is really quick to like learn new things, whether it's TikTok or virtual reality. We want to learn these new technologies. So we just took advantage of that through the work that we did, was to not say like, oh no, this is like we're stuck inside, but let's say we're stuck inside and let's enjoy it. Let's try to make the best out of it if we're going to be safe and things like that. So yeah, it was a fun kind of reinvention of like virtual reality, which was cool.
Certainly a generational difference right there. Cody, Lorenzo, you want to chime in?
Yeah, I would say that, obviously I think the pivoting virtual was definitely something that we, organically going into, obviously barbershops were shut down and there was a huge loss of revenue there. And so that made us obviously, really think about how we were going to continue to move forward. And I think a lot of that was just done through, we were able to get into funded enough to where we were able to create an online course. We were able to really like ramp up more support calls. And just, I think a lot of these things really allowed us to become optimistic. We also really obviously I think beyond giving our staff the time to, take mental health days off a month, we really grew tremendously. Obviously knowing that stress and the mental health and well-being and obviously the suicide rate has really been able to rise during the pandemic. That has given us such a huge workload. And so, it's been definitely it's been a challenge, but it's also been a great opportunity, I think, to rise to the occasion, to build a team. We've been able to scale during the pandemic, to going to put a satellite office in Atlanta and now going towards LA. And so I think I don't know if that would have happened without this being able to be at stake. So there was some great things that came out of, obviously such of the horrific stuff that has been going on with the health and well-being of people. We want to definitely lift that up, but I think the need of the work, all of our work is so much really needed now than it's probably what it's ever been. And so I think that I'm really glad just to be able to take that forward. So.
Yeah, I hear you. I think that we have been forced to think in different ways. We have been forced to think about what is possible with a much broader imagination almost, right? What was very natural for Jerome was not as natural for me, but suddenly confronted, you just had to go there. Take risks that perhaps we would have not taken. Cody, you want to go next, or you want me to go to the question for the audience that I will direct to you?
I can speak. I think for our community, for the American Indian community in the United States, we're somewhat of accustomed to having ceremonies or gathering in secret. But I think that with COVID, we used virtual platforms together, and we were able to connect so much, in my opinion, better than we have previously. We connected across tribal nations in both the United States and in Canada for social distance powwows. We were able to use those platforms as a way to educate tribal members on how to protect themselves from COVID and find out what resources they needed in their own tribal communities, whether that be homemade masks or whether there was some concerns about vaccine uptake or vaccine hesitancy. So the virtual platform for our movement has certainly been beneficial than going from community to community physically.
For sure, for sure. Well, thank you all. We have a couple of questions from the audience, and before questions, we have a lot of comments of thank you and yay from everybody in the audience. I have a question from the chat, and it says, first of all, thanks for sharing. As community builders, how do you measure success from your hard work to ensure that it was not done in vain? Are you receiving feedback from the community to know trust is being built from the partnerships formed for positive social change? So Rosemary, you want to start with this one?
Great question. I love data. I love being able to measure impact, but it is a very, very, very difficult thing. And you have, primary data and anecdotal data, and how do you know the impact you're making? I think, pragmatically, as a member of city council and as a person who works in public health, being able to engage with my community and feel that engagement reciprocated is a way that I am able to measure success. Knowing that when I send out an email, that people are responding and saying, when is this event? How is this happening? How can I help XYZ? That kind of engagement for some communities may be typical, but for my own here in rural Appalachia, a lot of our communities feel depressed and disengaged and disenfranchised.
Mm-hmm.
So when I know that people are reaching out and asking questions, and even if they're mad at me for a vote or for an issue that I'm advocating for, they're still engaged. That's a marker for success in my eyes. And then being able to take people to the polls, different organizations being able to register folks to vote. One of the organizations that I love so much, that's a national organization, is called Project ID, helping our homeless community members obtain necessary ID documents. That is a physical marker of success and progress. So it isn't always that you come by those data points, being able to measure your impact, but when you do, it's very satisfying.
So true and so important, the actual data and the anecdotal data, and how do you make sense of all those entry points? Jackie, how do you measure your success?
Well, first, as a community organization, the sort of what the goals are collectively determined. And so part of that is always doing outreach, always doing listening, always engaging people in the process all the way through the process. And then when we're talking about systems change or structure change, what's the goal, and using clear metrics. So, we eliminated the police department. Well, that's a pretty clear success, but we also want to make sure that we're reducing calls to service and that there's real transformation. So part of this implementation process is folks defining metrics that we can measure and evaluate whether it's getting to the whole point of if it's impacting people in a way that is positive, if there's things that need to be shifted, and constant evaluation of the actual work. But also, I think for us, it's also about developing leadership, building membership, and measuring that we're continuing to do that. Are we including people that are most marginalized, even within our own communities? How are we building solidarity? And so we evaluate ourselves, and we have people give feedback, and it's a constant process so that we can grow and strengthen, and that we're accountable to our community. So making sure that we're relevant
Right.
to the community that we're working within.
You know, I taught program planning and evaluation at San Francisco State for many years, and I wish I could have invited you to come and explain why program planning with clear goals and objectives and measurable timelines and an iterative evaluation process is so important. So I really like your answer. Thank you. Cody, what do you say? How do you measure the success of the work do you do?
This question makes me think of early on in the summer of 2020, there was some discussion about low testing amongst tribal communities in North Carolina. And what I thought was a success, or how I measure success, was when local tribal farmers got involved and wanted to know how they could increase testing in tribal communities. They started donating produce, fresh produce, so for two reasons. One, so we could increase the amount of testing, the number of tribal members tested, but two, to decrease food insecurity in tribal communities. And so while that's very hard to measure or to quantify, to me personally, that was a huge success to see my tribal brothers and sisters out there with fresh corn and tomatoes and squash, but then see them get swabbed for COVID.
Wow. Wow. Jerome, Lorenzo? Lorenzo, you want to take this one? We're talking about how you measure success.
Yeah, absolutely. So, you know, again, going back to what Rosemary said, the data is always an opportunity where it really allows us to understand our work, our impact, I think where we're going and where we should be going. But beyond that, I think that the most thoughtful impact has been, you know, to see a man emotional, right? Whether that's to weep, to cry, and that's really been a transformative moment, because as we know, you know, so the societal pressures and the complexities, the masculinity and what that really does. You know, we've had, you know, barbers to really to unpack, and these are Black men, right? These is when we talk, you know, knowing how we grow up to be tough, to be strong. That is really, I think, you know, it's kind of hard to measure that, right? And so I think that's been something that's really been able to stand out. But beyond that is, you know, knowing that there were a barber that went through our training, and you know, that was his kid that was able to go in to get some help, because now, because of the awareness, understanding of how impulsivity plays into, you know, depression and grief, and how trauma really manifests, is now this is just not an anger problem, right? This could be something different. So I think that's really impactful, and that truly can change the dynamics of a family, and it can really change the optimism of a relationship. And so that's really, those are just a few key things that's really stood out. That's kind of hard to measure on paper at times. And so I think that's really what's kept us fueled and motivated, is to know that that we may get a call from a 30-year-old, you know, African-American man that's now going to check into rehab, right? Because 2 weeks after that, we were there training about being an advocate. So those, again, are just opportunities in which we know the work is really just doing so much more good for the community.
So important. So important. Thank you, Lorenzo.
Yeah, and one thing I could say to build off of that, what everyone has been saying so far is uniquely being a part of the environmental movement and also being a part of the voting rights advocacy movement, is that a lot of it is intersectional with health, especially climate justice. There's a set IPCC report that says that we have 8 to 10 years before we start reaching irreversible feedback loops that exacerbate climate breakdown. And that's clear targets that we have to reach. And I think that's, we're fortunate enough to know that, like, if carbon dioxide and methane levels are dropping, then we are making progress. But it's also hard to see on the political side, because it really takes the political will, because a lot of the science is here, a lot of the facts are here. It's just, how do we build political will around taking the bold steps to limit our carbon emissions. So I think on that front, it's hard to measure progress because on one day they might say that they're going to take action and the next day they don't. So I think it's just a part of the work that we do is that like we try to just weigh what's going on around us, and we may have set targets, but the road to get there is pretty gray.
Yeah, I'm gonna remind us of the point that Jackie made, which is that we're here for the long run. And it may not be easy to measure the outcomes or the success in 6 months or in a year, but it needs to be an ongoing investment in the work that we're all doing. I just received the official 4-minute warning. So rather than going into one other question, first I want to thank you. And thank you from the bottom of my heart, not only as president of APHA, but as a fellow colleague in the field of public health for the amazing work that you do. And I would like to give you a little less than a minute each to tell us what do you want us to remember about your work and how we could support it. In less than a minute. Go, Cody.
That's tough. I think that having support on the local and the federal level for Indigenous communities and listening to Indigenous people and their needs, especially when public health researchers go into communities, go in as a guest, not as an expert. Go in and listen to the needs of people.
Thank you, Cody. Community-based participatory research. Jackie.
Thank you, everyone. It was such a pleasure to meet everyone. And I'm going to piggyback on Cody and say, I think the best way to support is to practice this in your own sort of local work, to really understand how to build relationships and support, not lead community, but support the leadership within communities. And when you ask the question about the best community partnerships, I'd say the best community partnerships we've had have had struggle to get there, because then they became authentic. And sometimes people shy away from tension and struggle and hard conversations. But those are the most lasting, authentic partnerships that we've had. And especially people learning how to listen and to understand that there's a lot of expertise within our own communities. So I think taking that practice, whatever the issue is, and then I would also just say to continue to look at this issue of policing as a public health issue, and no matter how things change and our attention spans change, to understand that it's still critical and it's important, and to continue to push for the bigger demands, to reimagine safety, to not see abolition as such an impossible and radical idea, but to learn how we can practice it in lots of different ways in our own communities. Thank you again.
Thank you. Lorenzo.
Yeah, I always like to kind of leave with this African proverbs: the child who is not embraced by the village will burn it down to feel its warmth. And I think that in itself says a lot to the work not only that we do, the work that we all do. It's about people being seen, heard, and being celebrated. I think during 2020, we realized that there was so much of people needing to be embraced and to be loved and to be heard. Sure. And so I think beyond the work that we do at a large level of, around mental health advocacy, and how we definitely have to reimagine such an old historical system of what was put in place so long ago, is really to listen, to build trust, but beyond that, to continue to show up for people, regardless of, their class, race, any of those things. So I just leave that on my part.
Thank you so much, Lorenzo. Thank you. Rosemary?
Thank you so much. I'm so honored to be in this room with these wonderful folks. I think, first of all, public health requires the public, and we have to make sure that we are doing this work in collaboration with our communities. And I guess my piece of advice would be that the next time that you are in a room where decisions are made, make sure there are seats available for folks in your community. Make sure that there is equal representation. Make sure that the people who get to make the decisions are the people who are impacted by those decisions. It's so easy to sit in a echo chamber and make decisions, and I see that, every day. So, my advice is to make sure that you are, you have the right folks at the table, and if your table isn't long enough, build a longer table.
For sure. Thank you, Rosemary. Jerome, you have the closing words here.
Absolutely. I think that a lot of what is encompassed in the work that we all do here is that, like, we all want to see legislation that changes as well. So I would say from the environmental movement, one of the biggest pieces of legislation that we want to see passed right now is the Climate Change Education Act. So if you're available right now and you're watching this segment, please take out your phone, or if you want to do this later, call 202-224-3121 and call your member of Congress to say... Slowly, say it slowly. Sorry, talking too fast. 202-224-3121 and call your member of Congress and say that you support the Climate Change Education Act, which will provide climate change education as a core subject through K-12 education, and also provide money for college students to study environmental health and to have money to invest in a lot of these technologies. So definitely do that when this panel concludes.
Thank you so much, Jerome. Thank you again, everybody. And I am now going to turn it over to my colleague, Susan Poland.
Thank you, Jose Ramon. I changed my name. Jerome, did I get it right?
Yes.
Okay. So I want to thank all of you as just so completely. This was inspiring. And as you were talking, I was writing down some words. And the thing that I found so interesting is those same concepts came up through each one of your presentations in different ways. And beyond the number of times I wrote, oh my goodness, or inspiring to what you were saying, a couple of things that I thought were just so true. It's people, we need to see people, and we need to see people who are both different from us. We need to see people differently. We need to reimagine our future, what success looks like, who our partners are. We need to break down the old to make sure that we are doing what's right for the new and the future. So our approach should be non-traditional, but we should maintain connectedness. And we need to practice, because these are not easy things to do. These are not easy conversations to have. And each one of you have shown us a pathway to have some of these difficult conversations and to do things differently. So again, thank you. I came up with a little rhyme at the end based on some of this too, which is that community leads on what community needs. And so I want to thank you. You have kicked off National Public Health Week in such style and with such power that I cannot, I can never ever show my gratitude strongly enough. So I hope you all are able to participate in future events for National Public Health Week and with APHA. And for those of you who are watching, thank you for taking this time with us. I hope you felt all of the feels that I did as well. And enjoy National Public Health Week, and phw.org is the place to find everything you need. So again, thank you, everyone.
Thanks so much.
Thank you.